Hello and welcome to Lake Orion Beaumont Health Series. My name is Jay Klein. I'm the Senior Physical Therapist at Beaumont Hospital, Troy.
And my name is Lisa Grabiel, and I am an occupational therapist at Beaumont Hospital in Troy as well.
And today we're going to be talking about what to expect following a total knee arthroplasty and a total hip arthroplasty. Here are the objectives that we're going to discuss today. First off, it's the definitions of a total knee arthroplasty and a total hip arthroplasty. Then we're going to proceed into the general indications, which are basically reasons why you would have these types of surgeries. And then the surgical precautions, which are things to look out for following having these types of surgeries. General patient information prior to having these types of surgeries, and how we as healthcare professionals will navigate you through the rehabilitation process following a total knee and total hip arthroplasty. We are also going to discuss relative recovery time frames following these surgeries, the role of both physical and occupational therapists, postoperative education, preparing for your returning home within your recovery process, and then the rehab options after discharge from the hospital itself. The Center for Disease Control has given us some metrics on these particular surgeries throughout the nation. And it's important to note that these are relatively common surgeries. I know it doesn't seem like it, but if you are going to have one of these procedures done, they're a relative commonplace to have these done. And they're very successful, and they are definitely a relative few amount of complications. In regards to a total knee replacement, there are 719,000 of these procedures performed yearly. So that is quite a lot. There's almost 1 million of these done throughout our nation every year. And then in regards to a total hip replacement or arthroplasty, there's 332,000 per year. So hopefully that illustrates that these are performed very frequently. And within some Beaumont data, at Beaumont Hospital, Troy, performed in 2014, there were 903 hip replacements and, hip and knee replacements in total. For knee replacements, there were 543, and for hip replacements, there were 360. This next slide illustrates some of the indications or reasons why you would have a total knee arthroplasty. And it's important to note that through this presentation, we're both talking about arthroplasties and replacements because basically they mean the same thing. 95% of the cases that we see are due to having a factor of osteoarthritis or arthritis in the knee. And typically, our patients or clients have arthritis over years and years and years, and it's a degradation of the bone within the knee joint. And typically what they would do is they would go and see their doctors or their surgeon, and through working with their surgeon, they will decide when and if surgery is appropriate. Other reasons why you would have a knee replacement are inflammatory arthritis, and a typical example of that would be rheumatoid arthritis or a psoriatic arthritis. And there are some other inflammatory diseases, but we won't discuss them within this particular presentation. Another reason why to have this disease is avascular necrosis, or a degradation of the tissue and bone in that area, malignancy or tumors, and also congenital deformities. So with a total hip arthroplasty, what you're going to see with this particular slide is arthritis again. 90% of the cases have a total hip replacement due to, again, arthritis being the primary culprit. And due to the types of surgeries these are, both a knee and a hip replacement, they're very similar to the reasons why you would have them. So again, other reasons why you would have a hip replacement are, again, inflammatory arthritis, developmental dysplasia, or maybe a childhood disorder or congenital disorder. Maybe you had trauma to that particular area. Again, malignancy or neoplasms. And then also osteonecrosis, or a degrading of that particular bone. So with total knee arthroplasty, what is that? It's important for us to discuss and explain exactly what that entails. What it basically is removing your knee joint, which is made up of the bottom part of your femur bone, and then also the top part of your tibia bone in your lower leg. And in some cases, they will also remove part of the kneecap as well. And essentially, they're going to replace it with a new type of hardware in there. What we're going to discuss with this particular presentation is replacing the entire joint, not just part of it. But that may be a particular option that your surgeon will discuss with you to replace part of the joint if that is indicated. And again, your surgeon will discuss with you what is the best option or procedure for you to have. So this is a slide that just indicates what a knee joint would look like following a replacement. And if you notice, it actually looks anatomically pretty similar to a joint as if one didn't have a surgery. So it's important to note too that the articular surfaces or the joints themselves are very smooth and the hardware is very smooth. That way, again, femur bone can glide on top of the tibia bone because biomechanically that's how we're supposed to move. So in regards to surgical precautions or things we want you to be aware of following your procedure, something that we have started at Beaumont some years ago is actually something called a perineural infusion device, or what we call a pain pump. And what that does is that greatly reduces the amount of pain you would have following this procedure. You will experience probably some excessive heaviness or numbness in the area, and that is basically due to this type of pain pump. But along with this type of procedure, you will experience some weakness in that area. And to compensate for that, what we will basically mandate that our patients have is something called a knee immobilizer or a knee brace on their knee, usually for about 2 to 3 days, to keep you safe while we're mobilizing you or helping you move within the hospital setting. And that's almost always removed and discharged prior to you going home. So some other surgical precautions or things to talk about are basically a trapeze is something that's available to you within the hospital setting to make it easier for you to get in and out of bed and move safely. So we have those freely and readily available for you. And we also, it's important to note not to put a pillow underneath your knee following this type of procedure during the recovery process, because we want to make sure that your knee is healing nice and flat and straight, again, to be anatomically and biomechanically correct so you can walk without a limp. It's important to note as well not to pivot or twist on that operative leg because it can cause some torque there, and it could also be very painful. And we certainly encourage ice even following the hospital process or following being discharged from the hospital to decrease swelling and decrease pain in the area.
So we are now going to go over the total hip arthroplasty. And with this issue, you're replacing the problem in your hip joint with an artificial hip. And your orthopedic surgeon will choose the best prosthesis for you. As you can see in the picture of the new hip, it fits nicely into the ball joint, and it will be much easier for patients to move once they have the new hardware into the hip. Some surgical precautions we'll go over with the total hip arthroplasty is first, we don't want you to cross your legs over one another, as you can see with the gentleman sitting in the chair. You may have what we call an abduction pillow to prevent your legs from crossing over. And we want our patients to lie on their side only, and you may lie on your side with the pillow between your legs. If you do not have a pillow between the legs when you are laying flat, it can lead to muscle imbalances as you're healing. So we want to make sure we give your new joint the best opportunity to heal. Some more precautions that we don't want you to be doing is we don't want the hip to be flexed more than a 90-degree angle. Your knee should be lower than the hip, and we don't want the patient to bend over. It's also a good idea to use an elevated chair, especially when you're using the toilet. We would like an elevated chair over the toilet or something to increase the height of your toilet seat to make it easier and not break your 90-degree precaution. Also, you will have a trapeze on the bed that you can use to assist with you to get to the edge of the bed. And when you are in the hospital, we have special chairs that we call hip chairs, which are a heightened chair where the elevation will allow you not to break that hip precaution of 90 degrees. Further surgical precautions to follow are we do not want you to pivot on your operated leg, we do not want you to twist on that leg, or force any movements. One thing that we want our patients to know, though, after this surgery is that it's okay to move. We just do not want any forced movement, and it won't pop your new joint out of place. It's very common for people to be moving, put full weight on their hip right after surgery.
Okay, so some other good information prior to your surgery is it's very important to note that we have a pre-operative class available. I would like all of you to know that because within the Beaumont system, preoperatively, as long as you're educated, you will feel much more empowered. And we would like you to go to the Beaumont website at www.beaumont.edu. This slide indicates how you would follow along. You would click on classes and then again click on classes and support groups and events. Proceed to pre-surgical education, and then go to your particular joint replacement that you're going to have. This is something that we offer throughout the Beaumont system at all sites. I highly recommend it. Nurses, physical therapists, care management, and other healthcare professionals are available. They are experts in their subsequent fields, and they can provide a whole lot of information to make you feel more comfortable prior to this surgical process.
One thing we encourage our patients to do before they have surgery is to designate someone, whether it's a family member, a friend, a caregiver, or someone who you can be able to count on from start to finish before you go into surgery and during your recovery to oversee your surgery, and you're able to help you in the home if you need any assistance. And we want you to understand the expectations of surgery and what to expect during your recovery. And whenever there is a hip or a knee surgery done at Beaumont, the ultimate goal is for you to go home and to be as independent as possible. So we want to make sure that you create an environment in the home that is most successful, and you have someone there to guide you as you are going through the recovery process.
The Beaumont Health System provides an integrative network or approach to these types of surgical procedures and within the entire Beaumont network. And this slide indicates that navigation of you guys, the patient, throughout the entire paradigm, or all the way prior to entering the hospital, within the hospital setting, and then we will help navigate you through the other particular settings that you may choose or your doctor would recommend go to. So again, acute care to maybe having home care, physical or occupational therapy, and then all the way we're going to help follow you and guide you into the outpatient setting as well. Another important point and advantage to coming within the Beaumont system is that we utilize a shared electronic medical record. This is something that we can't necessarily say for other hospital chains or systems. And again, that allows for greater communication within the healthcare professionals, so we know exactly what had happened with previous visits, all the way throughout your entire hospital stay, and again, throughout other systems while you are recovering.
So we would like to go over what to expect in the hospital. So when you arrive to the hospital, you will first have your surgery, and after preparation and surgery, you will then be taken to what we call the post-anesthesia care unit, also known as the PACU. After you have gone through the recovery room and doctors and your nurses all feel that you're ready to go onto our orthopedic floor, you will then be transferred onto the orthopedic floor. And most likely on the day of your surgery, you will be evaluated by physical therapy. And typically the next day you are evaluated by occupational therapy as well. Physical and occupational therapy will see you daily during your hospital stay, and you will have nursing staff there to take care of you as well, including any of your medical needs and to assist with pain management. And then from the orthopedic stay at Beaumont Hospital, you will then go to one of two avenues. The patient is typically discharged home, but we do also have patients who need further therapy, and they would either be discharged to another rehabilitation facility, or we would recommend home therapy after surgery. But we do want to keep in mind that the ultimate goal of our patients is for our patients to go home directly after surgery. So what to expect in the hospital? We want you to know that there is a team approach for your care. Your doctor will oversee your care after surgery until discharge from the hospital. And within that group, there are nurses, therapy, including physical and occupational therapy, as well as care managers who follow your entire plan of care throughout the hospital. Like I said earlier, the nurses will monitor you, address your pain, and provide any general medical care. Physical and occupational therapy will see you daily and address any of your rehabilitation needs. And the care management will coordinate a discharge plan and assist our patients in choosing a location for any further rehabilitation, such as subacute rehab, inpatient rehab, or home care therapy. Therapy across the recovery spectrum and what to expect is typically when you are in the acute care, which is known as your hospital stay after therapy, you'll have daily physical and occupational therapy sessions. Typically, our patients for both hip and knee surgeries have one session of occupational therapy a day and one session of physical therapy in the morning and one session of physical therapy in the afternoon. Once you have finished your hospital stay and the doctor believes you are ready to be discharged, we then help with care managers to decide your next level of care, whether it's you going home with assistance in home therapy or to subacute rehab. At subacute rehab, typically our patients receive about 1 to 2 hours of therapy per day, or if you are qualified to go to inpatient rehab at Beaumont, typically the patients are receiving 3 hours of therapy per day, which is very intense, but very good therapy at both places. Or the patient, like we had said, will go home, recover, and then they will begin outpatient therapy when their doctor deems them appropriate. Timeframes for recovery to expect for hip and knee surgeries. Generally, post-operative stay is 2 days within the hospital. For a total hip arthroplasty, the time frame for recovery is approximately 4 to 6 weeks with home care therapy and or outpatient therapy. And for a total knee arthroplasty, typical time frame of recovery is 3 to 6 months with home care and then outpatient therapy. And we also like to prescribe a home exercise program.
So it's important to note that there's a difference between short-term recovery and long-term recovery. What Lisa was referring to was a little bit of both. Short-term recovery basically just is how you recover and start to perform some of your day-to-day activities and get back to those things. And long-term recovery is typically where you want to be further down the road with recreational activities and fully functional and fully healed. So that may or may not be better than you were prior to the surgery itself. Okay, the role of physical therapy. Physical therapists within the hospital setting will provide and prescribe a therapeutic exercise program designed specifically for your needs. They will also teach you how to walk with an assistive device. Typically, we'll start with a rolling walker and progress you from whatever is deemed appropriate and safe, whether it be a cane or whether it be no assistive device from there. Instructions will also be on level surfaces and various types of surfaces that you may encounter at home and then throughout your community. And then we will also certainly assist you with strengthening and range of motion activities to optimize your healing and to get you back to fully functioning.
The role of the occupational therapist is to instruct you on how to safely complete your activities of daily living. And when we say activities of daily living, we generally go over how to get up and down from a toilet safely, in and out of your shower safely, as well as doing car transfers and going over activities of daily living for dressing, especially lower body dressing that a lot of our patients have difficulty with, and following your precautions. And the occupational therapist will teach you all the tricks for the trade on how to do all these activities of daily living while adhering to your precautions. We often instruct you on how to safely function independently in your home when you return home after surgery. And we will recommend specific equipment that will work best for you in the home and try to simulate your home environment as best we can, so when you go home you feel prepared to encounter any obstacles within the home and feel confident to do any of the transfers that you need to do.
So moving on to post-operative education, these are things that we want you to know following your surgery. We're going to start with incision care, and that's basically things that we want you and your buddy or family member to remember, and we'll talk about that in a minute. Signs and symptoms of infection. That's something that we take very seriously within the healthcare profession, is an infection. We want to give you some of those signs and symptoms so you can recognize it and certainly take care of it sooner rather than later. Preventing any post-op complications. And we're also going to talk about what red flags are after your surgery. And then we will proceed and conclude with a home exercise program, or just some exercises that you should be doing at your home in order to strengthen your body up and return to function.
We find it's important to go over incision care. When you get home, we always ask that when you designate a coach or someone to assist you in the home, that they assist you with the incision care as well. The best way for cleaning the incision is to always wash your hands before and after incision care. And the best way to clean it is to wash the incision with soap and water. Gentle soap is the best recommendation we have for patients to use, such as a Dove bar, a Dial bar, Safeguard. Any of those simple, gentle bar soaps that we use every day is perfect to use on your incision. And we want our patients to avoid any lotions, powders, or ointments that might irritate that area of the incision. And we want our patients to perform any incision inspections and make sure that everything looks normal as it's healing. So signs and symptoms of infection are increased or lasting redness, swelling, or warmth around the incision, any foul odor at the incision, a temperature at or above 100.5 degrees Fahrenheit, drainage that is cloudy, green, or yellow, or increased pain or pain that's not relieved by any prescribed medication. Going back to any of the drainage that is cloudy, green, or yellow, we encourage our patients or the person who is performing the incision care to use a white towel to dab dry at the incision, and to always be checking the towel for any signs of that infection if there is what we call a funky color that's cloudy, green, or yellow. And that's a sure sign that there may be an infection and that you would like to follow up with your doctor to make sure there's nothing wrong.
Okay, preventing post-operative complications. It's important to prevent any thrombophlebitis, which is basically a clot. We take every precaution that we have available to us within the hospital setting with things like SCDs, or sequential compression devices. Those are the items that will be placed on your calves, and they will squeeze on and off. It's an electrical device that will squeeze these essentially pads around your calves on and off, typically while you're sleeping or throughout the day, because you will initially not be moving as much as we would hope, obviously. Also, there's things such as blood thinners available, and we encourage all of you to elevate your postoperative leg or extremity to prevent any swelling. And certainly, we encourage you guys to get up and out of the bed and become active again. Moving on to infections, again, what Lisa was saying is washing your hands. Always remember to wash your hands with soap and water. Even if you don't touch your incision, just being very clean throughout the day is always a good thing to keep in mind. Pneumonia, we want to prevent pneumonia, so that's another reason why we're going to get you up and moving as soon as possible, and we're also going to prevent any falls within the hospital setting. Red flags, these are some of the red flags that we want you to keep aware of. Any absent or decreased pulses, any weakness, essentially anything on this list or maybe off this list and where you don't feel right or something isn't typical for you and your body. We're going to breeze through a home exercise program here. These are ankle pumps. These are very, very important, probably the most important exercise, and they help to prevent blood clots. The rest of these exercises that we are going to show basically are to strengthen from your hip all the way down to your ankle. So we'll breeze through these here. So we will be performing these exercises with you within the hospital setting, and you will do them at home. So preparing for your home.
We want to make sure that all of our patients have the appropriate adaptive equipment when they're at home, and when you're in the hospital, occupational therapists will go through the appropriate type of equipment that will best suit your needs in the home. Here are a few examples of the equipment that we offer through Beaumont, or you can get at any of the vendor locations that we can provide for you in the hospital, such as a sock aid or a reacher, a leg lifter or long-handled sponge, a long-handled shoe horn, raised toilet seat or bedside commode, a shower chair or a tub transfer bench, and pulling it all together.
All right, so these are the final points that we really want to you guys to remember throughout this entire process. Designate a coach. I've done this for some years now, and definitely designate a coach. They will help navigate you through the system. They will be your eyes and ears when you're not feeling so good. Attend that preoperative class through Beaumont. You will be much more informed, and you will feel much more ready for this surgery before, during, and after. Plus, your family will feel better. Prepare your home ahead of time. Preparation is key to success. Set your expectations according to your hospital stay. And lastly, prepare for your discharge to various settings, because you won't know, and you have to trust in us as healthcare professionals and your doctor to make those informed decisions. And lastly, if you guys do have any questions, please feel free to contact us at Beaumont Hospital in Troy. Our service number is 248-964-4014, and we look forward to talking with you. Thank you for your time, and bless you all.